Okay, so for the integrative health assessment, I don't currently have anybody at home to do this assessment on, so we're just going to use our imagination a little bit. So to start, I would go in and introduce myself. So I would go in and say, "Hi, my name is Eileen. I'm going to be your nurse today, and I'm going to do a quick assessment on you just to check and make sure everything is where we want it to be and to see if there's anything that's concerning." I would perform hand hygiene, go in, wash my hands, get in between my fingers and in my nails, and then I would identify the patient. So, do you mind if I see your wristband for a second? I would take a look at the wristband. Can you tell me your name and your date of birth? They would then tell me their name and their date of birth. I would use standard precautions. So if they're like in an ISO room, I would, of course would like use a mask, gown, and gloves. So at this point, I would make sure that I have, after I wash my hands, I would put my gloves on. Privacy and positioning, I would make sure that the curtain is pulled, the patient has privacy, and they're sitting upright and comfortable. I would then take their temperature, so I would pull from the Massimo, put it under their tongue. Can I put this under your tongue, please? And then I would wait until it beeps, and I would see that it's 98.7. So I'm like, perfect, you're doing good. No fever, that's great. I would then check their pulse and check to see that they've got a bounding pulse and that it's not, that I can feel it, it's palpable, it's the word I'm looking for. So I would check, and I would check for 1 minute, and I would see that they are 75 beats a minute. That's perfect. Great. I would check their respirations, not letting the patient know what I'm doing because they tend to breathe a little differently. So I would try to, continue working while checking for their respirations. And as I'm looking, I'm seeing that they're about 17 breaths per minute. That's perfect. I would document that. I would check their blood pressure, put the cuff on, push the button, and making sure that their hand is their arm is like below their heart. They're not like up this way, or they're not like laying all funny. Make sure that they're positioned correctly while I'm doing the blood pressure. And I see it's 120/80. That's a perfect blood pressure. I would let them know that their vital signs look great. I would ask if they're having any pain. Are you having any pain today? They say no, that would be great. If they say any pain, say that they're having maybe a 6 out of 10, then I would look on their MAR and see if they have anything to help with that pain. I would ask about if they follow any type of diet, if they follow maybe a cardiac diet or a diabetic diet, and ask them, how they're doing with that diet. If they have any concerns or questions about how they can improve it, or anything that they have concern about in regards to their diet, I would check their weight and height and just make sure that they're within their BMI. Ask them if they've had any weight changes recently. If they have, I would ask them if they've been trying to lose weight or if it's just unintentional weight loss. And then I think that's about it. I would say thank them for their time. Thank you so much for your time, and let me know if you need anything else.